Hi, my name is Narada Immaculate, and I'll be doing a skills video on administration of oral medication. I have used MAR number 3, which has the 4 medication, that is acetaminophen, Tylenol 500 milligrams per 15 milliliters, and then it also has diphenhydramine, Benadryl 25 milligrams. It also has amoxicillin 250 milligrams, and it also has metformin glucose, which is 500 milligrams. In this case, we have a liquid medication, which is acetaminophen, Tylenol, which I actually have to administer too. So before I actually move into my patient's room, I have to make sure that I verify the healthcare provider's order, and then I also have to verify the 6 rights of the medication. So first of all, I have to verify it's the right patient, it's the right drug, it is the right dose, it is the right time, it is the right route, and then it's also the right documentation. So I look at my MAR, and then I against my medication that has been given. So like I said, I have acetaminophen, Tylenol, which is the brand name, 500 milligrams per 15 milliliters, and then I also have diphenhydramine, brand name, which is Benadryl 25 milligrams. I also have amoxicillin 250 milligrams, and then I also have metformin glucose 500 milligrams. So I've gathered my supply. I have everything. I have my gloves. I have my cup. I have my my small paper, cleaning paper or cleaning towel, and then I also have a measuring cup where I'm going to pour my liquid medication. So now I actually move into, after I've done the first verification, I move into my patient's room. I knock on the door. After knocking on the door, I close the door for privacy, and then I come in and then I introduce myself. Hi, my name is Narada Immaculate, and I'll be your nurse for today. After I've introduced myself, I also request my patient to I verify my patient with 2 identifiers. Would you please tell me your first and last name? So they tell me their first and last name and their date of birth. After they've told me their first and last name and the date of birth, I check onto their wrist to verify it's the right patient. So after verifying it's the right patient, I position my patient in a better position. I can either tell them to sit down, or I can tell them to lie on the side. And in this case, I'm going to request my patient to actually sit down on the bed so I can be able to administer the medication. So what I do next, I actually look onto the medication on the side of the bed, and then I again verify it, compare it with the doctor's order, and then I also check if it's the right medication, the right route, the right time, the right dose, and the right documentation. So at this, then I tell my patient what the health provider has actually ordered me to give them. So, Mr. Smith, your health provider has ordered me to give you acetaminophen, brand name Tylenol 500 milligrams per 15 milliliters. Anything in milliliters, that you should know it's actually a liquid. And then I also tell them diphenhydramine, Benadryl, which is 25 milligrams, and then amoxicillin 250 milligrams, and then metformin glucose, which is 500 milligrams. So after I've told my patient what the health provider has actually ordered, I again educate them on, that is the second time, so I educate them on what the medication is used for, what the medication, the side effects, and then the adverse effects. So in this scenario, the side effects are actually basically mild, and they're not really life-threatening. And then the adverse are really they can actually cause their life-threatening they can cause a lot of damage, or they are life-threatening. So before I actually do anything, I then perform hand hygiene. After performed hand hygiene, I put on my gloves. After I put on my gloves, I go back and tell my patient, oh, Mr. Smith, this will take only 5 minutes. And I tell them, I educate them on what it does. So acetaminophen, which is Tylenol, is used for pain, that is mild pain. And in most cases, the side effects are headache, dizziness, or dizziness. And then sometimes the adverse effect can lead to liver and kidney problems, and they can also have a skin rash or reaction. And then I tell them, I also educate them on the difluprednine, which is Benadryl, and this is an allergy medication that is supposed to be given to them, and the side effects are usually drowsiness, and then dizziness, and then the adverse effects can be urinary retention and also seizures. That is the Benadryl. And then I also tell them, educate them on amoxicillin. Amoxicillin is used to help cure. It's an antibiotic that is used to cure bacterial infections. So I tell them the side effects are also headache, and then dizziness. And then I also tell them the side effect or the adverse, which is hives. They can develop hives. It can either be on the body or anyway. And I also tell them the metformin, which is glucose, which is 500 milliliters, what it does. This is a type 2 diabetic medication that is used to lower down blood sugars or blood levels. So I tell them what exactly it does. After telling them, then I tell them the side effects. The side effects, Mr. Smith, can be diarrhea, they can be decrease in appetite, and then I also tell them the adverse, which is abdominal pain and shallow breathing. So after I've explained that part, after I've performed the hand hygiene and everything, I then tell them that I'm going to actually pour some water in my cup, and then I can request them. Some patients would love to actually take their medication using probably another type of drink, like a juice or something. Some would prefer the water. After I've checked what they prefer taking the medication with, so Mr. Smith, what would you love to take your medication with? And then they tell me, and in this case, it's water. So I have my water in my cup. After that, I prepare my medication. So I prepare my medication. Remember, they said this is metformin, and then I asked my patient if they would love to have their medication at once, or they would love to take it one by one. And then in this case, Mr. Smith says that they would love to have their medication at once. So metformin, 500 milligrams. So I put one, and then again, I look at amoxicillin, and then look at this is the third check, and also check against my MAR, if it's the right patient, it's the right medication, it's the right route, the right time, right documentation, and the right time and the right drug. So this is the third check. So I open, which is amoxicillin 250 milligrams. I again put it there, close. And then again, I check if it's a diphenhydramine Benadryl, which is 25 milligrams. I check against my MAR to see if it's the right patient, right medication, right route, right documentation, and then the right drug and the right time. Remember, the time is 19, which is 7. They told me to give out this medication at 7. So I have Benadryl. So I'm done with my my 3 medications. Remember, I have a liquid. I don't mix it together with this. So I tell my patient to position themselves well and get ready. So after that, I give them their medication. After giving them their medication, I again give them their water to take. After pour the water, so I'm done with that part, the water and the medication. So after I've done that, I again get my liquid, which is acetaminophen Tylenol. Tylenol can come in different forms. You can actually have it in tablets too, but in this case, the healthcare provider has ordered a liquid. So Mr. Smith, this is a pain medication. I verify it with the MAR that has been given to me to verify if it is the right patient, the right drug, the right dose, the right time, the right route, and the right documentation. So Tylenol, 500 milligrams per 15 milliliters. So I'm going to pour 15 milliliters into my cup. So I go onto eye length down, make sure that it's 15, and then I hold the label. I hold the label so the medication doesn't pour onto the label, make it dirty. So it's 15, and then after that, I clean the top of the bottle so the medication doesn't actually slide down to cover the label. And then I trash that, and then I cover my bottle. So I show the camera that it's actually 15 milliliters that I've poured, and then after that I give it to my patient. Mr. Smith, this is your acetamol. So my patient takes it, and I give my patient water. So after that whole procedure has been done, I then clear my table and then take off my gloves. And then I wash my gloves. I perform hand hygiene. After I have performed my hand hygiene, I then thank my patient for having let me administer the medication to them, and then I put them in a right position, in a comfortable position. I put up the rails, the 2 rails on the side, so they can, for safety. And then after clearing, I document my procedure. I document how the whole procedure has gone, and then I leave the room. Thank you very much.